Good afternoon, Melrose. It is Mayor Paul Brodeur with your weekly COVID-19 update. As many of you already know, there is great news on the vaccine front. U.S. health officials from the CDC on Tuesday gave the final sign-off to Pfizer's kid-sized COVID-19 shot. These doses are just a third of the amount that is given to teens and adults. Already cleared earlier by the FDA, this CDC approval is a milestone that opens up a major expansion of the nation's vaccination campaign to children as young as 5 years old. The announcement by CDC Director Rochelle Walensky came only hours after an advisory panel unanimously decided Pfizer shots should be opened up to the 28 million youngsters in that age group. So where can your child get the vaccine? Some pediatric practices are offering shots, and you should start by checking in with your child's doctor. The state reports that there are over 500 sites offering the 2-dose Pfizer vaccine, and that the state does not anticipate any supply issues that plagued earlier efforts earlier in the pandemic. You can use vaxfinder.gov or call 211 to make an appointment. And here is what you need to know about local efforts. DPH is offering doses in blocks of 300 to allow communities to run their own clinics. Our health department has requested vaccines from the Commonwealth and will run a clinic as soon as we receive those doses. The city is also making arrangements to have the Vax Bus return to Melrose to help folks, principally in senior housing, to get their booster shots. Now, fair question, an important question is why get your child vaccinated? Well, I'd ask you to consider the comments of Dr. Kevin Churchwell, who is the president of Boston's Children's Hospital. Dr. Churchwell said that vaccinating children against COVID-19 will protect them and will slow the spread of this disease to the unvaccinated and to other very at-risk individuals. He went on to say that vaccinating children will reduce the toll of this virus on everyone. The availability of the vaccine in younger children, according to Dr. Churchwell, represents a tangible opportunity for all of our children to return to normal daily activities and routines, and that's critical to their well-being. His colleague, Dr. Frini Polanco-Walters, added that they are highly recommending the vaccine because the research shows that the benefits far outweigh the risks. Again, please reach out to your child's doctor if you have any questions or concerns about the appropriateness of the vaccine for your child. And now the infection and vaccine data update from DPH. The weekly COVID-19 case data from Melrose, published by DPH yesterday, indicates that our positivity rate is at 1.97%, and the statewide average is a little bit lower at 1.7%. And our daily average incidence rate per 100,000 has increased to 15.8, but it is still lower than the statewide rate of 16.5. Regarding vaccinations, Melrose continues to show positive data around vaccinations with slight increases again in several categories. Our overall vaccination rate as a community remains at 73%. Now, as the children's vaccine was only approved earlier this week, DPH data does not include vaccination rates for kids aged 5 to 11 years old. I expect that data will be forthcoming in the coming weeks on a community-wide basis. Again, I want to thank all of you for everything that you are doing for yourselves and our community as the pandemic progresses. Together, we are getting through this. Thanks again, and have a great weekend.